Germany is bracing for a rapid spread of the Omicron coronavirus variant. With the variant already in the country, the government is responding by stepping up its vaccination program and introducing new restrictions. Tight limits on social contacts will come into effect after Christmas.
Omicron is on the advance in Germany, and the politicians say it's time to react. After their meeting, Chancellor Scholz and the state premiers said private gatherings would be limited to just 10 people if they're vaccinated or have recovered from COVID. For the unvaccinated, socialising will be even harder. They will only be able to meet 2 other people. The moves are prompted by fears the virus could spread over the holidays.
I
can understand everyone and each of you who doesn't want to hear any more about corona, about mutations and new virus variants. But we cannot and must not close our eyes to this next wave that's beginning to loom over us. Corona's not taking a Christmas break. Despite that, most of those buying last-minute gifts will be able to hand them over in person on Christmas Day. The new restrictions will only be compulsory from the 28th of December. New Year is set to be unusually quiet, with sports events played in empty stadiums and dance venues closed. This is not the time for parties and social evenings in large groups. The government is putting hopes on continuing the high rate of vaccination through the Christmas period. They hope to deliver millions more jabs by the end of the year and 30 million in January. In Berlin, many people seem unfazed by the prospect of tougher measures. I hadn't planned anything big anyway, just a small family gathering. That's best.
We're
10 people, and of course we would like to celebrate Christmas together. The adults are all boosted, and I get a PCR test every other day. So we feel we are on the safe side.
Fühlen wir uns sehr auf der sicheren Seite.
6 of us will get together with friends, unfortunately without family. They're in Stuttgart and Munich. We don't want to get on the train and driving's too stressful, so we'll visit them next year. The Chancellor says though infections are currently falling, it's only a matter of time before Omicron is the dominant COVID variant in Germany. Corona has not stolen Christmas, but the strain it is putting on the public and the politicians is not over yet.
Well, for more, let's talk to our chief political correspondent, Melinda Crane. Melinda, the new measures don't take effect until after Christmas. Wouldn't they do more good if introduced right away?
In fact, they're not compulsory until after Christmas, but some federal states will be instituting them sooner. For example, Mecklenburg-Vorpommern in the northeast of the country has decided that as of Christmas Eve, they will be putting measures into effect because intensive care bed capacity there is severely strained. So there is some leeway. Nonetheless, no question, the authorities could have gone further, but the government faces something of a dilemma, Terry, because the fact is that infection rates have been falling recently. And until these latest warnings, many people here in Germany felt that things were looking up, especially compared to late November when cases were much, much higher. But the fact is that at the moment we're in a lull between 2 waves. The 4th wave that was caused by the Delta variant is receding, and that 5th wave hasn't hit yet. And that makes it very difficult for the government to essentially get way out in front with the measures that it imposes. And in fact, that was recognized by the Chancellor. He said yesterday he's aware that people are tired, people feel brittle, and therefore I think there's a sense on the part of the government, particularly since the health minister had said there will be no hard lockdown before Christmas, that they need to take this step by step. But they did face some pushback from the federal states.
Well, state and federal leaders in Germany have disagreed on the best way to fight the pandemic in the past. Is there more consensus this time, Melinda?
Outwardly, there was consensus, but as I said, a couple of federal states did feel that the measures don't go far enough. They made that clear in a press conference following the meeting. So the blanket of consensus was a bit thin, perhaps. These particular states, they include Baden-Württemberg in the southwest, Saxony in the east. They're concerned that the new government hasn't established the necessary legal framework for ensuring that in an emergency, uniform measures can be adopted quickly across all of Germany. As you know, such a law was in place under the last government. This government decided to repeal it in hope that the Bundestag, the legislature, would then have more of a say in the measures that are established. But as I say, several states feel that we don't at the moment have the necessary legal basis. And there was also quite a heated discussion about a last-minute warning yesterday from the country's Center of Disease Control, which did, in fact, advocate a harder lockdown.
Well, as you mentioned earlier, Melinda, parts of Germany, the intensive care units are already full. How concerned are authorities about the capacity of the country's healthcare system to deal with what's coming?
They're very, very concerned. Some experts have said that Omicron could be the dominant variant here in Germany as early as the end of January, and that we could then see new cases up to 100,000 a day. That will put an absolute strain on intensive care capacity across this country. As you know, in late November, early December, some hospitals were already having to do triage, send patients elsewhere for intensive care treatment. That's one concern. The other concern is essential services like electricity, water, garbage disposal, and so on, because we may see many, many essential workers falling ill.
All right. Melinda, thank you so much. Our chief political correspondent, Melinda Crane. And here's a roundup of some of the other developments in the pandemic worldwide. Portuguese bars and restaurants will now close from the 26th of December, 5 days earlier than scheduled. Infections in Portugal have risen sharply, despite a vaccination rate of around 90%. Israel has announced it will begin offering a fourth dose of COVID-19 vaccine to medical personnel and people over the age of 60. This comes amid concerns over the Omicron variant. And the EU's COVID-19 pass for travel will now expire 9 months after vaccination unless the holder has a booster shot. The new rule is due to come into force in February.